You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
Hey, hello. I'm Dr. Rosy.
Hi, I'm Dr. Krish. We welcome you to the 4th episode of Season 1 of Therachronicles.
And today, we are going to talk to Dr. Niladri Konar. Dr. Niladri is a consultant physician in Acute and General Medicine in the UK. He's currently based in London. He has completed most of his medical training from Kolkata in India. He has had exorbitant experience in diabetic care, both in India and in the UK. On a personal note, Niladri has been my MBBS batchmate from IPGMER and Assiscame Hospital, Kolkata. It gives me immense pleasure to have a 16 years friend with us here today on Therachronicles.
Hello, Dr. Niladri. Welcome to Therachronicles.
Thank you, Rosy and Krish.
So, Niladri, for the uninitiated, if you can kindly introduce yourself. I mean, what lies behind the white coat, the Niladri behind Dr. Niladri? Your interests, hobbies, and anything else that you would want to share for our listeners.
I'm Niladri Konar. I'm a doctor currently in UK in London. I have done my MBBS from Kolkata and done my post-graduation in medicine as well in Kolkata. And then I shifted to UK for some experience gathering, for some higher training. And my ultimate intention is to get back to Kolkata in the next couple of years. Other than being a doctor, I am very much fond of traveling the world.
Yeah, I keep seeing you travel on your social media updates.
Yeah, but for the last 1 year, I have been almost constricted to my home, and that's the sad part at the moment. But I am a cricket lover, I am a music lover, and a travel passionist.
And speaking about cricket, it has majorly come to a standstill, unfortunately, because of the ongoing COVID pandemic, right?
Yeah.
Fingers crossed. Let's hope that things get back to normalcy soon. And apart from that, Doctor, can you please briefly tell us about your work life? As in, what branch of medicine do you practice and where are you associated with currently?
So at the moment, I am working as a consultant in Acute and General Medicine in Princess Alexandra Hospital in Harlow, which is just in the northern fringe of London. And so very recently, I've been promoted to a consultant role. It was in 2020.
That's amazing. Congratulations on your promotion.
Thank you. And my next step would be to get some experience in other hospitals in the UK before I move back to Kolkata.
Okay, that's great. So the season 1 of Therachronicles is dedicated to diabetes. That is also why we have called it the Chronicles of Diabetes. So Dr. Niladri, I would like for you to please share a significant story from your practice related to any diabetic case.
Yeah, I can share a story. It was not directly my case, but it was a case in our clinic in a hospital in London. So we received a patient from the police. The initial story to begin with was this was a taxi driver who was middle-aged, and there were 2 or 3 police complaints against this driver that he was not responding to the people who were waiting for him on the roadside. And so he was booked by the police, and when they started inquiring him, he said that he never noticed anyone calling him from the side of the road. And the police thought that he needs a medical checkup, and when the medical checkup was done, they found that he was having a paralysis of one of the muscles of the eyes, which we call the lateral rectus. He couldn't see, his vision was not very good on the peripheral aspects, and so he was missing the people who were waiting for him with their hands up. And after much further investigation, it was diagnosed that it was all related to his diabetes, which was undiagnosed for maybe quite a long time, because his results showed that he was having many complications related to diabetes, and he was never diagnosed before this incident. So this is one of the stories I remember.
So, without getting into too many technicalities, what complication of diabetes do you suspect might have led to this lateral rectus palsy?
The main, I think it was the involvement of the nerves, which is very common in diabetes.
Diabetic neuropathy.
Yeah.
Yes. So we did talk about diabetic neuropathy in our last episode on complications due to diabetes. For our audience who would want to know more about it, please do check out the previous episode, the link of which is in the description below. So Dr. Niladri, this was very unfortunate, but an interesting clinical presentation from a clinician's perspective.
Yeah.
Like we know that in lifestyle disorders like diabetes, what we see in the clinic is just the tip of the iceberg. So Niladri, what do you perceive about early screening in diabetes?
So I think early screening is very important in diagnosis of diabetes. Mainly, I think I usually concentrate on people who have family history, who have other comorbidities, mainly obesity, other heart diseases, blood pressure problems, and sedentary lifestyle, to have early screenings and diagnosis. Otherwise, the other thing I would like to say is people must not get obsessed with screening tests. That's another aspect. Nowadays, everyone is having yearly 6-monthly tests from age of 30. I don't think that's too much necessary. But of course, people who have comorbidities, who have family history, should get screened once in a year or once in 2 years from young age, so that we could catch the disease early and keep it under control.
So you mean that people with diabetic predilection, or the ones who are more likely to develop diabetes, should screen more often than people who are not likely, right?
Yes, I personally think so. And of course, if someone crosses 50, then they should be tested every now and then. But young people should get tested only if they have comorbidities or have predilections.
You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
So you spoke about sedentary lifestyles. I would like to know more from you about how significant do you think is lifestyle modification when it comes to lifestyle diseases like diabetes? Your take on this?
Yeah, lifestyle modification is a very important aspect for controlling diseases as a whole. For diabetes, it's very important to maintain the body weight, BMI, so that we could get a control over the disease and prevent the disease from happening to start with.
We come across so many people these days who consume loads of fast food, avoid working out and going to the gym. Unfortunately, even their type of work makes them confined to the chair all through the day. So will you ask them to work out and have a more mobile lifestyle? What is your perception?
It should be healthy eating and exercise in people, which could prevent diseases from happening.
And what amongst the lifestyle modifications do you generally prescribe your patients?
Exercise.
And any specific duration or schedule that you prescribe to them?
There are numerous guidelines, but I would say to maintain a proper BMI would be the target, proper body weight, so that you are not going obese. It depends on how much you eat, how much you mobilize while you are working. So ultimate goal is to maintain a proper body weight so that you are not getting obese.
Do you recommend trainers for them? Because more often than not, Working out is a challenge to the cardiovascular system too.
Yeah, it needs experts if you're not being able to control yourself. But if you are happy doing it yourself, like if someone is regularly playing badminton or tennis, then he doesn't need any guide. But if someone needs some guide for exercise and diets, then they should always take help.
Absolutely. Well, I would like to know, while treating your diabetic patients, what are the major challenges that you have faced as a clinician?
I would say starting insulin on diabetic patients. It's very challenging because patients, mainly in the Indian context, patients are very much
Resistant.
resistant. They don't want to take insulin because first of all, it's an injection. They are very much afraid of that. And they always think that when someone is getting started on insulin, that diabetes is out of control and they are getting to the last stage, something
Right.
like that. So that's the biggest challenge. But most of the patients, when they continue insulin for some time, then they realize that the sugar is under better control. They are being able to take a better diet than they had previously. The number of pills have come down significantly, and most of them are happy once they follow it up. But it's very difficult to initiate.
In chronic lifestyle disorders like diabetes, we see that patients are majorly non-compliant. Say from taking pills to follow-ups to investigations to workouts, there is a tendency on the part of the patients to being non-compliant with treatment protocols. So any story from your practice where you can remember that non-compliance to treatment led to any diabetic complication?
So we had a patient who came with a ear infection. He was a non-diabetic on insulin. He came with a ear infection. We changed his diabetic medications from oral to insulin and started him on antibiotics. When he was with us in the hospital, we administered insulin, but when he went home, he stopped the insulin himself and also did not take the pills which were stopped. And he came back to us in a week's time when the infection had already spread to his inner ears, the bones of his skull, and also landed up with infection of his brain, which we call meningitis. So that was one gross example.
Well, I can imagine the sad state of affair that this case must have landed up with.
Well, Dr. Niladri, we are still amidst a global pandemic. We have seen lockdowns all over. What are the challenges that you have faced as a clinician with your diabetic patients?
So the challenges were mainly everyone was afraid to come to the hospital, to the clinic, or to investigation centers, and so they missed. Most of them who don't have home instruments to check sugar levels, they missed their appointments and they landed up with high sugars. We saw a huge number of rise of complications of diabetes, which we call the diabetic ketoacidosis, mainly in young type 1 patients, type 1 diabetic patients. And there was a huge surge. So we also did an audit regarding that, and there was at least 100% more patients than usual time during the COVID lockdown, because they were not testing much, they were not getting their insulins on time and things like that. So there was a huge surge of complications, acute complications of diabetes.
Now, diabetic ketoacidosis is a medical emergency, isn't it?
Yeah.
So it must have been an added burden to the healthcare system, which was already pretty loaded with the ongoing COVID pandemic, right?
Definitely.
So how do you guys troubleshoot these issues?
So my experience during the lockdown is almost the whole experience is in UK. So here we have a diabetic team, which is the diabetic nurses who are going to the houses in the community who take care of these patients with insulin dosing and monitoring their sugars. So we tried to make that team more robust so that the care was adequate and we could prevent some of the complications. Ultimately, it was not such a success, I would say. We saw many patients even after adding to our diabetic nurses out of hospital in the community.
Yes, precisely what you said. Despite all these arrangements, many patients did turn up with diabetic ketoacidosis.
Yes.
So this brings us to the last question for today. I will not keep you waiting any longer, doctor. Any take-home message that you would like to share as a doctor with our listeners, especially the diabetic folk?
Yeah, the only thing I would like to say from my experience, from my understanding, is diabetes itself does not kill, the complications kill. So if you could prevent the complications by keeping your sugar under control with proper medication and proper insulin, whatever your doctor prescribes, that should be okay. Diabetes is a very controllable disease, and with your healthy lifestyle and diet, if you could control everything, your sugar levels, and prevent the complications, you'll have a good life. But if you fail to prevent those, that's what kills, with all the complications with the nerves, with the heart, with the eyes, with the kidneys. Everything that goes wrong is with the high sugar are the complications, and that's the reason why people die. If you could keep the sugar under control, that should be okay.
So thank you, Dr. Niladri, for such a great take-home message for the diabetic people who are listening to us. And thank you for finding time from your busy schedule for Therachronicles. I'm sure our audience definitely got to learn a lot. I personally feel very enriched having this conversation with another fellow doctor.
Thank you, Rosy and Krish, for having me on Therachronicles. I have shared my insights on diabetes and hope this benefits the audience.
This was Dr. Niladri Konar, consultant physician in Acute and General Medicine in Princess Alexandra Hospital, Harlow. Now, to know more about diet and diabetes, watch out for the next episode of Therachronicles next Friday, where we will talk with a renowned dietitian, Priyangi Lahiri, where she will give you more professional insights on this issue.
Thank you for tuning into this episode of Therachronicles. Found it useful? Like, comment, and share it with your friends and family. To keep yourself updated with our latest episodes, subscribe to our channel and press the bell icon. We would love to hear from you at therachroniclespodcast@gmail.com.
The interviews present personal opinions of the guests and are generic in nature. Therachronicles and Therachron does not endorse to the opinions expressed by the guests. We understand that every individual is different and requires customized care. Your doctor knows the best, and the advice, opinions, and suggestions in the interviews are not an alternative to your doctor's opinion. Consult with your personal physician and experts before implementing any changes in your lifestyle, medication, and therapy. Therachronicles or Therachron does not have any endorsements or financial interests with any of the products, medicines, medical equipment, or brands mentioned by the guests in the interview.